Everyone. This is Angel Mathis. I am a mindset coach for Christian healthcare workers. And on today, I have one of my clients that would like to speak a little bit about what we've done together and the different things that she's achieved. She's an LPN and she will tell you guys how she feel about everything and what has her journey been so far. So Mandy, you're up. Go ahead.
Thank you, Angel. So, my name is Mandi Dyck. I am a Christian who is also a licensed practical nurse. I live in the northern part of Alberta, Canada, in a small town that most people haven't heard of. I have been a nurse for about 3 years now. I started working home care and then moved into acute and emergency, and I'm now doing the perioperative specialty program to work in the OR.
Right.
And as I've walked through my 20s and my nursing career, I have always struggled with anxiety. I've had a diagnosis of anxiety for probably 15 years, and it has really affected my life. I still have a vibrant and healthy life, but on the inside, things are hard.
Mhm.
And that makes it really hard to go to work a lot of the time. Sometimes there's lots of sick calls and things because you just can't focus and you can't get yourself to get there.
Mhm.
Yeah, I found myself always stressed. I still find myself stressed at work, let's be honest.
Mhm.
Um, you know, I would take everything personally. I needed daily affirmation. I'm such a people pleaser.
Mhm.
A lot of the times, even still, I work through this, but embarrassed to be just an LPN.
Gotcha.
Even though in Alberta the scope is the same as an RN, there's really nothing to feel ashamed about. But here we are. Uh, Sometimes anxiety even makes it hard to go to church, even though you've grown up in the church and that's your family and things. But when you move to a new place, you need to find a new church, and anxiety and stress really can limit you and disable you, really. And I got to the point where I was sick and tired of that. And then God connected Angel and I on Facebook. I'm really not a big Facebooker, but it was really cool how the Lord worked there. And
Yes.
she invited me to take her course where we do weekly check-ins and we do Zoom meetings because we are on opposite sides of the country. And that has
Yes.
been wonderful. And we work on goals that we both talk through that and then she lines them up with her program, and basically it starts off as a session where I tell her about my week, and that has been such a blessing. And I'm able to download in a way that's not negative, but it's positive. And she's very affirming and very encouraging in that. And we always pray together afterwards. And that's huge because you can't do anything without the Lord. And where
Mhm.
two or three are gathered, He is there. And that makes a big difference. Um, some of the specific things that we've worked on together are ways to disengage from stressful situations, specifically in healthcare and in the hospital. Very, very busy. Go, go, go. And when you are still a new nurse,
Mhm.
that makes things hard, and it makes it hard to learn. Your learning curve, there's no time for the curve.
Mm.
And she has helped me come up with strategies that I can use while in that busy work environment where you just want to go find the whole closet and cry, or you know you're calling in sick tomorrow. And she has taught me some things to disengage from that, whether it's, some of the things are like you just pray as you're going, you just do it. And sometimes you got to inside yourself step away from the situation if it doesn't involve you but it's causing you stress and you're on that unit.
Yeah.
You really got to tell yourself, you got to be firm, and you got to say, that is not about me. I'm
Mhm.
okay, I'm going to go do my own job.
Right.
Pardon me, sorry. Another thing that we have worked on is relaxation techniques, things like pressure points, and making sure that you are daily walking with the Lord, and that if you have a certain type of devotion style that works for you, whatever that may be, you do it daily, not to make it a legalistic thing, but something that you just need to put some discipline in. and do it every day. And that is hard. I'm still working on that. Because we are tired. We got so much stuff we got to get done in just 24 hours. Part of that is sleep. But yeah, and making sure you get enough sleep and you eat healthy and take care of your body. Those are things you hear every day. You're slammed with those things, but it's so helpful. And she always reminds me to get enough sleep and to read my Bible. And so I've been working on that. Let's see here. Another thing that has helped, and we talk about this being just a puzzle piece, but going on some medication to help curb the chemical aspect of the anxiety and some depression and things, that has really helped as well. But the biggest thing I think is the techniques that we talk about that pertain to nursing and healthcare working, because Angel is a nurse herself and she has a wonderful career behind her and lots of experience. She can relate to everything you're talking about, everything. Even though we're in two different healthcare systems, nursing is the same.
Yes, it is.
And it's a burnout in both countries. And we don't want it to be a burnout because it's our passion and our joy and our calling for most of us. And she has been helping me remember that and how to continue in that. And you know, a lot of it is the joy of the Lord is our strength, but how does that really apply to you? And how do you access that really? Because I know for me and a lot of other people, you know the truth, but to get it to here and the rest of your body to have a somatic response, it's the furthest distance. But so we have done 4 weeks together total, stretched out a little bit, and we're going to be doing another 4-week sessions for sure. And at this point, I'm still anxious. It doesn't go away. It's not a switch, but I am able to tackle it and go out and go to church. And I find I'm not calling in sick to work, and I'm making sure I'm getting enough sleep. And I'm trying to apply those things. I mean, it's like I said, it's not a switch that you can just turn on. It takes time and effort to work on that and really apply it to your life and to make certain things a habit. You know, the 30-day thing, you got to do it over and over, and then your heart will be there. Yeah, the anxiety is much less though, which, praise the Lord, is so great. I find myself remembering to pray at work, which sometimes is really hard. You're so busy, you forget. Oh yeah, I'm a child of the King, and I can talk to him whenever I want, and he's always there, and he's got my back. And Angel's been really encouraging me every session that we do, that we actively remember that we can walk in authority, and we can walk in that authority that we are the children of Christ in a humble and confident way. And people will notice, and people will ask you, what's up? Yes. And that is super infectious. And the last thing I want to say that I've been working on, that we've worked on together is being actively aware of what's really going on, whether you're at work, out, at home, whether it's like an earthly situation that you actually need to deal with, because you got to pick your battles. Sometimes you got to have those hard conversations to deal with people. But sometimes, and a lot of times, it can be both, but calling it what it is. And if the devil's interfering with you, you call it out. And we've been talking about that, and that has been super encouraging, because that definitely affects us. And so my time with Angel has been so encouraging and so empowering, and I'm looking forward to more sessions with her as I grow. Thank you.
Thank you. That was very appreciative, and I appreciate you so much.
Oh, well, I've come to really appreciate and cherish our chats. They're a big highlight for me.
That's good. I'm glad that you're learning, and then not only that, you're activating the strategies to change you holistically. So I appreciate that very, very much. So you all heard it from Mandi. Her life is full and it's changing wonderfully. Yeah. So we're excited. Well, thank you so much. Thank you so much. I'll be contacting you soon. Okay. Bye-bye.
Bye-bye.